Welcome to week 7 of Chain, cycling against hip pain. The aim of this week is to talk about the options that you've got if the Chain programme wasn't to work. What other treatments are there in terms of joint injection and surgery, but also teaching you a new cycling technique. According to the experts, everyone should receive advice about being active, about doing exercise and losing weight if required. Some patients will require joint injections and a very few will require surgery. The good news is that even if you require surgery, by doing the Chain programme, you're being prepared for surgery. You'll do better during and after surgery if your joint is stronger and more mobile. This is a quote from David, who completed the Chain programme and went on to have a hip replacement. He felt that he got a much better result from the hip replacement having completed Chain. Joint injections are normally performed by a specialist in hospital. They consist of an injection of local anaesthetic and cortisone into the joint. The evidence is that they can give good short-term relief for a number of weeks or a number of months, and they're recommended for patients with moderate to severe pain. The surgical option for arthritis of the hip is a hip replacement. This is where the old hip is removed and an artificial hip is put in. Even if you require this, NICE recommend that you have the core treatments first. Those are education, exercise and weight loss if required. The good news is that of all the operations that you can have in your life, a hip replacement is the most successful, and the majority of patients get rid of their pain and get back to full activity. We're now going to hear from a participant who's completed the Chain course.
The key things that I learned really is that first of all, even if it didn't help the pain immediately, it was going to be very much better if I was going to have an operation. So it was sort of had a goal involved in it. I didn't really expect it to be as effective as it has been.
The cycling technique that we're going to teach today is your foot position.
So in this week's spin session, I want you to concentrate on your foot positioning. So make sure your foot is pushed well into your toe clips and that your saddle height does allow you to work with a flat foot. As you push down through from 12 o'clock to 6 o'clock, the effort is at 3 o'clock and you want your heel to be slightly lower or at least parallel to your toe. Then, as we've spoken about before, you think of this action of scraping the mud off the sole of your shoe. So you lead back between 6 o'clock through 9 o'clock and 12 o'clock, leading with the heel. So you're working with a flat foot. That will engage the muscles of your calf and allow for a steady action with effort through all points of the pedal action.
Week 7 summary. If you don't get full relief of your symptoms from the Chain programme, you can consider a joint injection or a hip replacement. By completing the Chain programme, you'll be getting yourself fit for surgery and make sure you get a better outcome. In the spin room today, we're going to teach you foot position. So thank you for listening, and I'll hand you back to your facilitator.